Okay, let's get started. Good morning or good afternoon or good evening or good middle of the night to you all. I'm Jackie Drew and I'm currently serving as the president of the World Physiotherapy subgroup in oncology, HIV/AIDS, and hospice and palliative care. I'm very pleased tonight to introduce Amy Dennett. Dr. Dennett has been working on an evidence-based toolkit for exercise that she's here tonight to share with us. And I'm just so pleased and excited that we've been able to meet up, in this, given the time zones, and have this presentation because we've had a lot of interest in developing skills in oncology rehabilitation among some of our member organizations. So just a brief overview. Dr. Dennett's going to be speaking for the first hour. And then if you do have questions, you can write them in the chat at any time, but we will be considering questions and we can have a discussion at the end of the session after the presentation. So without further ado, Dr. Dennett, if you would care to take this away.
Sure. So thank you for having me along today to talk about the Cancer Exercise Toolkit. So this was a project that was completed smack in the midst of a pandemic last year, and probably quite fortuitously, it worked out being a better project for having been done during COVID-19 and having to be done remotely, because it meant that we could reach a much broader audience and include physical therapists from across Australia for the design process, which I'll talk about during the presentation, as well as being able to have a more international audience as well. So this project was completed with quite a large physiotherapy team with members from La Trobe University, the University of Melbourne, Monash University and University of Western Sydney. And it was funded by the Australian Physiotherapy Association's Kosh Trust, which we're very thankful for their funding. And so this particular grant scheme is to support the education and development of physiotherapists, particularly within Victoria, which is the state that I live in. So in terms of the presentation today, I'll be going through the Cancer Exercise Toolkit, how it was designed, and also go through some of the evaluation and the results that we have got from this toolkit. As I was mentioning just before we started the presentation, this is hot off the press. We literally just submitted the paper for publication on Friday, so you guys will be kind of the first to hear some of the preliminary results about how the Cancer Exercise Toolkit has gone. So I'm just going to move on to the next slide. Okay, so as you may or may not be aware, access to cancer rehabilitation is generally quite poor, particularly exercise therapy in cancer rehabilitation, even in Australia. So we conducted a study back in 2015, which was part of my PhD thesis, looking to kind of benchmark where oncology rehab was nationwide. And in terms of Australia and our context, we work in a public health system, well, mixed private and public health system. I work in the public hospital setting. So this study was really looking at trying to find exercise-based cancer rehab programs within public hospital settings across Australia. The first cancer rehab program of its kind was only set up back in 2010. So it's a very new area for rehabilitation within Australia. We've had cardiac and pulmonary rehab for decades, but cancer is still only emerging. And so 5 years in from our program being set up, which was the first in Australia in Melbourne, we wanted to find out what the kind of current status was. And back in 2015, just 1 in 200 people who are diagnosed with cancer in Australia had access to a specialised exercise-based cancer rehab program. So that equated to about 31 programs nationwide for a population of about 26 million. So not a lot. And this theme is present in many countries across the world, not only our well-developed countries, such as in the US, Canada, in Europe and the UK. Probably Europe's a little bit more developed than us, but also our non-developed nations, you know, this might not even exist at all. So this is a real problem, given that exercise is increasingly becoming on the agenda for cancer care. So part of this study, it was a mixed method study. So we interviewed clinicians, we surveyed them, and then we also interviewed clinicians that were running these programs about what they thought were the barriers and facilitators. And 3 things came up in terms of how we could potentially improve access. So one of them was increasing the awareness of the benefits of exercise for people with cancer. And I think particularly in Australia, we've done a really good job of that over the last probably 3-4 years in particular. So you may have heard of the Codesign statement that was released back in 2018. So this is the Clinical Oncology Society of Australia. And this was the first time that a peak oncology body was really endorsing exercise. An exercise that was delivered by an exercise specialist, being a physical therapist or an exercise physiologist. So I think the awareness has definitely increased amongst both the clinical community and patients in general. We also found that we need to potentially engage oncologists more to be able to boost referrals, and that's kind of a work in progress through efforts such as COSA and other peak oncology bodies, and also from health network to health network. But something that we thought that we could help contribute to is upskilling the workforce, which was the aim of this project. And when we look at some of the literature that has come out recently, so this is a position paper that was released by Katie Smits back at the end of last year, I believe. You know, we need skilled clinicians. The agenda for this paper is to make exercise as part of standard cancer care by 2029. And this paper has a number of statements in terms of how we can potentially achieve this. And one of them is by building capacity of our workforce. So in saying that, part of capacity building is professional development and having resources. So few resources exist to support clinicians providing cancer rehabilitation, particularly freely available resources. So I sit on a variety of committees here in Australia that aim to help develop our clinicians and get exercise on the agenda for people with cancer. So the Victorian Exercise and Cancer Advisory Committee and the Clinical Oncology Society of Australia. I'm on the Exercise Implementation Committee, and both identified that we need access to online resources to help with this capacity building process and help, therefore, facilitate implementing oncology rehabilitation with a focus on exercise. And so we know that online material can be effective and feasible for educating physical therapists about exercise. So multimedia innovations such as video, infographics, discussion forums, quizzes, podcasts can all help enhance therapist engagement. And using online material has been effective in other physical therapy contexts. So particularly GLAD, the osteoarthritis program, they've done a lot of work to try and build capacity of physical therapists in OA, using online communities of practice and websites, also being used in pediatric populations. And in particular, a resource that we have in Australia that I'm not sure is probably less known in other areas of the world is the Pulmonary Rehab Toolkit. And this was developed well over 10 years ago now, and it was designed predominantly by physiotherapists, and it's now considered an essential resource for physiotherapists and physio students working in pulmonary rehab. And so this toolkit really provides a basic outline of how to run a pulmonary rehab program. It's got how to get started, how to assess, how to treat, as well as resources for evidence-based practice, basically. So this toolkit had always kind of been in the back of my mind, starting in cancer rehab, and was something that I thought was really important to develop in a cancer context as well, because it really provides you with the basics for what you need to get started, essentially. And given that exercise-based cancer rehabilitation is very similar in design to pulmonary rehab or cardiac rehab, we thought that this would be potentially a good starting point. So the aim of this particular project was first of all and foremost to develop a cancer exercise online toolkit. And then secondly, to evaluate the use of the toolkit and its effect on knowledge, confidence, and behaviour of exercise professionals. And when I talk about exercise professionals in this presentation and in this context, what I mean is physical therapists and accredited exercise physiologists. So this project used Codesign. So Codesign is a form of participatory action research that uses a patient-centered approach to seek and understand how people experience processes or services in order to develop either services or resources to help improve patient care. So we took this co-design approach to developing this website because we wanted to develop a website by physios for physios, essentially. So this co-design process usually involves a systematic method of 6 steps. So it's about setting the plan, engaging with either your consumers or the end users. In this case, it was the physios and EPs who were going to be designing and then using this website, capturing the experience, understanding the experience, improving the experience through co-design, and then measuring the experience, which is the evaluation phase. So we had a broad number of participants that were involved in designing this website. So our primary participants were our exercise professionals. So we had 2 groups that participated in the workshops. We had our generalist exercise professionals. So these were more our clinicians who work maybe in general practice, have occasional contact with cancer survivors, but cancer is not their core business. So these might have been musculoskeletal physios working in private practice, cardiorespiratory physios working in an acute hospital, for example. We also then had a second group who were our expert exercise professionals. So these were experts from across Australia who had at least 2 years of cancer-specific experience. So these people were located either in universities or hospitals who could really provide that expert cancer knowledge. We then had a steering committee to help provide feedback and drive the website. So we had a consumer representative, a rep from our Australian Physiotherapy Association. We had an oncologist, someone from our Cancer Council, which is our national, I suppose, cancer charity. We had a representative from our Department of Health and Human Services. So they oversee public hospitals within Victoria. And we also had a rep from private health as well. So we really wanted someone from each of those key stakeholder groups that could potentially promote and endorse this website in the longer term. We had consumer stories, which I'll talk about in a moment. So we had 3 consumers who had participated in an exercise-based cancer rehabilitation program share their story and experience to help kind of set the scene for our workshops that our exercise professionals were participating in. And then finally, we had our research team. So there was 8 members from a variety of universities, and I'll present them at the end of the project as well. So we really had a lot of different people with a lot of different knowledge coming from different perspectives to really help inform this resource and make it the most comprehensive and accurate that it could be. So in terms of recruitment and the study flow, we had 25 actual co-design participants. So these were the exercise professionals. On average, they had about 15 years of total either physiotherapy or exercise physiology experience. So we had 13 experts and 12 generalists. This graph might be a little bit tricky to see on your smaller desktop screen, but I'll kind of talk you through it. So in terms of our 25 participants, most of them were physiotherapists, so 21, and 4 of them were exercise physiologists, and they worked predominantly in hospital settings across Australia. So first of all, the first process of this co-design approach was to interview a selected number of patients to capture the depth of their experience. And then we edited a video that was presented at 2 separate workshops. So the dark blue boxes, we had group 1, which were our generalist exercise professionals, and then group 2, who were our expert exercise professionals. We then so we screened them and invited them via email to participate, and then we conducted 2 workshops, so one with the generalists and one with the experts. So once we conducted those first workshops, so they were to identify learning needs, we then brought them together for a 3rd workshop that was completed just 2 weeks later. And then I just realized this graph might be incorrect. So they then did a 3rd workshop where they all came together and they shared their ideas and what was similar and what was different. We then went away and created a prototype. And then after 4 months, we came back, we brought all the exercise professionals together to show them essentially what we'd done. We also sent them a link to the website so they could provide feedback before that workshop. They provided some feedback. We then went back and refined the website. There was a 3-month period before then piloting the toolkit, and then another 3-month period of evaluation with a survey. So what I'll show you next is just a section of the short clip that we did with patients. So patients were asked about their experience with the health service in general and their experience with cancer rehab before being asked more specific questions about what they think is important for exercise professionals to know about delivering exercise with cancer. Exercise for people with cancer. So I'll just stop sharing for a moment while I bring up the video. I'll just show you a couple of minutes of this. So in the workshops, this video went for approximately 10 minutes. Share screen. All right, so hopefully you can see what you should know on your screen now, and I'll just play it for you.
There seems to be a lot about the treatment, but not a lot about recovery. I felt there was a gap, but there was not a lot about, like, once you had treatment, that was it. Basically, you're on your own. So the group dynamics is a lot more important than you realise. I mean, just you're all got a goal, and you're all, you know, you're all in there together, and you've got this unwritten rule that you know what you've been through with the cancer.
It's important for it to be kind of laid out in a way that's simple, easy to understand, and also easier to do, because I know it's just kind of hard to try to think for yourself about these kind of things if you have those goals. And I mean, having good health while you're doing cancer treatment, or just with having cancer, I think, I mean, it can only help, but like advice from people who had an understanding of what they were doing on what exercises I could do, how to get to kind of the next level of things if I thought that things were kind of plateauing at any particular point. Exercise, food, like maybe diet, like those things and how they work together, like how to cater to an individual.
If they know a bit about the symptoms, the treatment, and the side effects and the outcomes, it's very helpful for them. Certainly, well, I suppose it applies across the board for people who treat who do rehab for any type of cancer. Is that it's an 8-week program, and I thought about it. I realised there's people coming in and going out all the time, but I thought if it could have been, say, a 10-week program or even a 3-month program, it might have been even better. Was if it brings your level of fitness up a few degrees more, it enables you to do more. So, yeah, I was a bit disappointed when it finished.
All right, I'll just stop the share there and bring up the main screen again. Okay. Sorry, this is not quite working as well as it was before. Why is this not bringing up screen too? There we go. All right, has everyone got the presentation back up, I assume? Okay. So yeah, that was the video that kind of set the scene for our initial workshops that we completed with the patients. So there was some kind of key touch points there that the participants raised that was important for people to know, which really helped build that foundation of the website. So things like really knowing what you're doing. So particularly, you know, things like side effects, and, you know, being individually tailored your exercise. And I'm sure for those of you on the line who have worked quite a fair bit with people with cancer, these themes have probably, you know, come up time and time again in your clinical practice. Okay. So when we looked at the first two workshops, when we interviewed both the generalist clinicians and the expert clinicians separately, there were a number of themes that came up between the two groups. So in general, they agreed that they needed easy access to evidence-based practice, acknowledging that it's often difficult to keep up to date, especially in this area that is rapidly evolving all the time. And they gave some suggestions of resources that they might want on the website. However, there were differences between the two groups. So those in the expert group offered a more nuanced knowledge to what's required in a cancer rehab program. So even down to little things like, you know, when you're setting up a program, you need to have access to a cytotoxic spill kit. Or when you're doing assessments for people with cancer, you might need to actually use some cancer-specific type assessments. Whereas when we interviewed the generalist clinicians, they were probably more concerned about access and being able to generate referrals and communicating with other health professionals such as general practitioners. And they were also quite concerned about things like goal setting and how to practically run a group, particularly if you're running a group that might have people with and without cancer in it, for example. So from these workshops, we developed 8 key areas that kind of set the bones for the website. So we developed a homepage, screening and safety, which included red flags, precautions and contraindications, assessment, and it was decided that screening and safety should be quite separate to assessment, more so we could really draw attention to the safety considerations, that it didn't get lost in other parts of the assessment. That was really important. We had exercise prescription, education, and given that access was a theme that was brought up by both groups in terms of just not knowing where to find cancer-specific rehab programs, it was decided to have like a location page with a map of where they could find programs, as well as having practical resources on the website as well. So we then went away and developed the website, which was later named the Cancer Exercise Toolkit. So it went through a couple of iterations of the URL. I think it started out as being the Oncology Rehab Toolkit. And then we did a bit of a poll in one of our workshops to work out, you know, what are we going to call this website? And this was the name that was chosen by the Codesign group. So it was actually set up on a pre-existing platform that we had at the university called TREC. So this is translating research, evidence and knowledge. So we kind of had some bones, and we did have some limitations about how we could design the website just because of using the pre-existing platform. But we were able to go away and get a logo designed, which again was informed in part by the research team and Codesign group. So what I'll do next is maybe just share the screen with the website on it to give those of you who might not have seen the website before just a little bit of an idea in terms of the main components. So I've just got to find it on my screen now. It's funny how these things work really well when you test them, and then not so well when you go to use them in real life. All right, so can everyone see the website on their screen? You want to just give me a thumbs up? No?
No, you need to share it. There you go.
Okay, good. So this is the homepage. So on our homepage, we wanted to keep pretty simple. We've just got an introductory video, and we had some media about a cancer rehab program on there, and we've linked this with the Canadian exercise the clinical exercise physiology lab from University of British Columbia. So we were able to team up with Dr. Kristen Campbell, who was the lead author of the latest American College of Sports Medicine guidelines. She helped inform this website. So given that they have quite an active Twitter feed, we embedded that on the website as well. So as you can see, the page is broken up into 8 sections. So the first one is just about getting started with more practical tips about how to start a cancer rehabilitation program. So learning about why it's important to run it, what the goals of oncology rehab are. Referrals was really important. So who's suitable, who could refer, having the practical considerations as well. So just knowing what equipment you need, what staff resource you might need, and funding. And then what was identified particularly by the generalist clinicians was forms and templates that they could potentially print off and then use in their practice. So next is probably one of the most important sections of the website that came out as well quite strongly in our, both in Codesign and then in our evaluation, was having information about screening and safety. And so as you can see, this section is quite comprehensive, and just a note about website design and the navigation. So this particular bar and sub-menus, we went through many kind of different, what's the word? We tried different types essentially, and this is what we came up with in terms of being able to be the most easily able to navigate. So we have a section on precautions and contraindications, and then we go into things like common cancer treatments. And I think 3 of our main big things that we need to be aware of as physiotherapists dealing with bone emets, fatigue, and lymphedema. So if we go into precautions and contraindications, these are drawn directly from the paper from the Lancet Oncology that you're probably aware of, that was by Daniel Santamina and the Canadian group. So really highlighting the main things that we need to know from that. And then as part of feedback that we received from the Codesign participants, we also have a printable guide that for people who are working in the clinic, they can print it out and put on their wall, or easily be able to reference that as well. So in terms of the screening and safety, when we did workshop 4, when people offered improvements on the website, one of the main pieces of feedback was that they wanted more information about particular cancer populations, and also a little bit more information about cancer treatments, which is then when we went in and designed individual pages for each type of treatment. So they had a better idea of how they can potentially modify exercise for each of these different types of chemos. For example, one thing that was quite a challenge to balance in designing the website was how much information put into it and the scope, because there's just so much knowledge out there about all the different cancer treatments and all the different types of cancers that we didn't have scope to include absolutely everything. So we really wanted to just be able to provide at least the basics and then links of where people could find further information if they needed it. Another important part was exercise prescriptions. So a key thing going into designing this website was being able to translate existing guidelines. So using the American College of Sports Medicine guidelines released at the end of 2019, we wanted to be able to translate that into the website, as well as giving people an idea of how do we actually calculate basic things that we should know from our undergraduate training, that sometimes we get a little bit lazy when we're actually in practice. So, you know, basic things like performing a 6-minute walk test, giving suggestions about when you might use a treadmill test. In our strength training part, you know, how do we do a 1RM a test, because that's something that you might not necessarily be always doing in other chronic disease groups, but can be quite important when you're working with people with cancer who might need to work at a higher level. So then we've embedded videos in there as well. And I'll just skim through. Lastly, we had an education section. We thought it was important not only to have education for clinicians, so where they could find professional development and have podcasts, but also patient education as well. So we didn't have scope to design new resources for this website, but clinicians provided suggestions for existing resources that we could embed or link into this website. So we've got great videos from our Cancer Council. There's exercise demonstrations in here, as well as some additional resources from our international colleagues. So from Macmillan over in the UK, and the one group from Penn State have some great exercise videos on here for patients as well. And then finally, the location map. So this is very Australian centric. So only focusing on programs within Australia at the moment, also acknowledging that the Moving Through Cancer website and that movement actually already has an international registry of cancer rehab programs. So we don't want to be duplicating that information. But as you can see, whilst there's probably a few more programs than there was in 2015, there are still large proportions of Australia that don't have any cancer-specific rehabilitation. So a lot of it is centred around the metropolitan areas, and particularly within Victoria, which is the state that I am from, where we do have some prominent exercise researchers. We have a government that's quite invested in putting money into exercise and cancer. So the political climate is a lot more amenable to setting up cancer rehab in Victoria, as opposed to necessarily other parts of Australia as well. So that's a little bit of a quick whiz through the website there. And I'll just bring the presentation back up. Okay. All right, can everyone see the presentation back up on the screen? Give me a thumbs up or let me know if you can't. All right. So that was the design of the website. Now the next phase was an evaluation. So this was a pilot evaluation. So it was completed, we had a baseline survey and a 3-month follow-up survey post-implementation. The evaluation focused just on exercise professionals, so our physical therapists and our exercise physiologists. So we disseminated a survey to participants. So this baseline survey had some demographic information. We embedded the determinants of implementation behaviour questionnaire in there to see if we could potentially have an effect on that with our website. Our 3-month follow-up survey also included some usability and utility questions, and there was a knowledge quiz that was embedded into the homepage of the website as well. We also looked at some website metadata in terms of how many people were actually using and accessing the website. So we had a comprehensive dissemination strategy. Quite fortuitously, probably with the timing of the website, we were able to launch this on World Cancer Day. And we were able to utilise our professional networks quite well, both nationally and internationally, to be able to disseminate this website. So we were aiming for at least 100 people to complete the baseline survey, but ideally we wanted more. We didn't cap recruitment for the survey because we offered PD certificates to people, and we really wanted to reach as many people as we possibly can. So our dissemination strategy included sending a survey link with the URL to our Codesign participants, hospital networks, our Department of Health and Human Services, our Cancer Council, our TREC, or La Trobe Sport Exercise Medicine Research Centre, which actually has quite a broad international audience. We have a physio group within our Australian Physio Association called Physios for Physical Activity. We also access some of our cancer groups as well. So our Victorian Cancer Survivorship Program, our Integrated Cancer Services, as well as Clinical Oncology Society of Australia, and of course, the Australian Physio Association and the Exercise and Sports Science Association of Australia. We also used our international colleagues, so the Canadian Physiotherapy Association, as well as through social media, we were able to access some big journals, so BJSM, JOSPT, and the Clinical Exercise Physiology Lab at UBC as well. So really trying to draw on everyone that we possibly could to send the message out there about our website. And in order to try and improve our response rate at 3 months, we held a celebration event in May where Dr. Kristen Campbell, or Professor Kristen Campbell now, provided a webinar to participants who actually completed the survey, and we did this in an attempt to improve our response rate. So when we look at that phase 2, the evaluation, so we did find that the toolkit had broad and international reach. So we had 414 people initially access the toolkit from our survey URL, keeping in mind that the website was actually accessible outside of our launch and the survey, but there's no way that we could have possibly known who was accessing the website if we were just looking at those analytics. But controlling it through the survey, we were able to get some demographic data. However, of these 414 people, there were a number that were ineligible to complete the survey because we had doctors, occupational therapists, nurses, all different disciplines accessing the toolkit, which was really great to see, considering this was a website that was designed predominantly for exercise professionals. So of those that were eligible, 320 of them actually completed the survey, and the majority of these were physiotherapists. Like the Codesign group, they had an average of about 15 years experience, and interestingly, the majority of them were from a non-cancer specialty. So we had more generalist exercise professionals accessing this website, and the majority of them had less than 5 years of cancer-specific experience. So it seemed to be that it was people who didn't know a lot about cancer were the ones really seeking that further information. And when we look at a breakdown of countries, so we did have responses from 26 different countries from pretty much all continents, which was amazing. The majority were obviously from Australia in terms of our dissemination strategy and it being a very Australian website, but we did have people from the UK, Europe, America, Asia, Africa, and even the Middle East. So we are reaching quite a large number of physios across the world. So first of all, in terms of usability and utility, the toolkit was found to be easy to use. So this graph demonstrates the responses that where people responded that they agree or strongly agree to each of these questions. So it was easy to use, it met their expectations, the organisation of the website was well done, it was useful, and probably most importantly, whether participants would recommend the toolkit to their colleagues, nearly 80% either agreed or strongly agreed to that. So it was definitely a useful kind of website for clinicians. And there was the opportunity for some open-ended feedback. So as one participant said, it was a great source. It was like filling a gap, like the pulmonary rehab toolkit, which is what we modeled this website off. There was a couple of responses about difficulties accessing the toolkit. However, I think this was more related to the nature of the survey and the survey link, because there was an automated URL that went on to that. But if you actually look at accessing the toolkit, if you put in a Google search, Cancer Exercise Toolkit, it'll be the first thing that pops up in your web browser. So I think this is more related to the nature of our survey as opposed to the actual website URL. So we've made sure that that is accessible in response to that feedback. So in terms of toolkit usage, so usage did vary. So we looked at the usage after our 3-month pilot period, so between May and October, that's just gone. So our usage peaked in June, where we had about 1,200 views, and then it really kind of dropped off in October. And interestingly, and I think thanks to this webinar, if we look at the November stat, that has hopped right back up. So I think part of the issue with the toolkit usage is potentially just lack of promotion of the website. And when we look at the breakdown of what pages were most interesting or looked at by health professionals, so the locations page had the highest number of views, and then patient education. So actually something I haven't mentioned is the motivations for using the toolkit. So there were 2 main motivations that were described. It was to improve patient care and for professional development. And these results kind of converge with that, as well as the themes that came out of our co-design workshops. So precautions and contraindications was the next viewed, and then clinician education. So our exercise professionals really have like a thirst for knowledge about exercise and cancer, essentially. So overall, the website is receiving about 866 views per month. Over the duration of the website being launched, it's had over 5,500 views, and the highest per day has been 151, which was one day back in May. Now, probably most importantly, we've designed this great website that seems to be easy to use and easy to navigate, but does it actually improve knowledge, skills, and confidence? And whilst we acknowledge that this is just a pre-post survey, this preliminary evidence suggests that it potentially is useful for improving knowledge, skills, and confidence. So I will put out there straight up off the bat is that only 58 people completed our follow-up survey. So it was quite a disappointing response rate, but not uncommon in physiotherapy education related resources like this. So we had to consider this quite carefully in the analysis and interpretation of our results. So we did complete a sensitivity analysis to try and give us a little bit more confidence. Also important to know that the demographics of the people who completed the baseline and the follow-up survey were actually similar. So still a similar experience level. They were still mostly more generalist clinicians. So again, gives us a little bit more confidence that this is representative potentially of the whole sample. So our survey had 45 items on it, but there was about 8 that came out strongly in the sensitivity analysis. And I've picked out these 4 particular ones because I think they reflect the aims of developing this website in the first place. So the first one was, I know how to deliver exercise oncology rehab following the guidelines. When we looked at baseline, so our red and oranges disagree, strongly disagree, neutral, and our greens are towards the end of agree, strongly agree. So as you can see, quite a lot of people didn't necessarily know how to deliver onc rehab according to guidelines, but after access to the website, this proportion is greatly increased. So well over 80% of people were a little bit more confident in terms of knowing how to deliver exercise according to guidelines. And so a similar pattern comes out in all of these questions. So I have been trained to deliver exercise according to guidelines. So as you can see up at the start, probably about 35% or thereabouts actually agreed to that they hadn't really had any training, and this significantly improved to well over probably 60% there. The next one was, I have the skills to deliver exercise oncology rehab following the guidelines. So again, maybe like 50-50, but at the 3-month follow-up, the majority agreed that they did have some skills. And the last question was, I am confident that I can deliver exercise according to the guidelines. And as you can see at the 3-month follow-up, a much greater proportion were confident. So this gives us some initial reassurance that this website is helpful for clinicians and their professional development. So in terms of implications for practice, so we did have broad international reach, which is really important given the recent calls that we've had for increased access for cancer survivors to be able to access exercise and embed it into standard care, particularly given, you know, an example is we have 35,000 physiotherapists in Australia who could potentially have the skills to deliver exercise to people with cancer, but very few of them have specialist qualifications. So there's this untapped workforce that could potentially deliver care. And we know from some of our other research is that they do feel underprepared to deliver exercise to people with cancer when they are new graduates, and they're still not very confident even when they're a few years out. So this website provides some initial evidence that this could be something that could support clinicians when they do graduate from their undergraduate physiotherapy degree. And so this provides a new opportunity for for professional development in this area. And given that knowledge, confidence and skills in terms of delivering guidelines improved, this could potentially be a useful knowledge translation strategy. You know, we know it usually takes about 17 years to translate research to practice, and we don't really have, you know, that time when we're wanting to develop services. We need to get that research out there now so we can have, deliver the best care and the most effective care for our patients. And it was really interesting that the areas that had the highest traffic on the website really aligned with the learning needs and previous research that we've done, that, you know, we need to have information about precautions, contraindications, red flags. We need to have patient education resources for people. So we also found, you know, web design elements are quite important. And so we did make sure that we had easy navigation. We included images and multimedia content, and, you know, the structure was in a logical kind of format, because people aren't going to use the website if they find it hard to use. But what we did notice is that sustainability is a challenge, and it was something that was brought up in our co-design workshops quite early. Our usage did decrease over time, so there's the potential that we need ongoing promotion. Ideally, we'd like to have this website endorsed by some of our peak bodies, maybe starting with organisations such as the Australian Physiotherapy Association and potentially some of our international physiotherapy associations as well, and making sure that we keep the website up to date with new evidence, because if it becomes outdated, it becomes redundant. So overall, we hope that this website will help support clinicians, build capacity, and ultimately lead to better access to exercise therapy. So finally, this is my wonderful team who helped create this website. We have Nick Taylor from La Trobe University. We have April Chu, who's actually a clinician physiotherapist who was our project officer, and she essentially learnt a whole new skill set. She basically built this website for us. So a massive kudos to April for putting this website together. We had Clarice Tang from University of Western Sydney, Christian Barton, who's also from La Trobe, Christian Osadnik from Monash University, Catherine Granger from University of Melbourne, who you may be aware of, does a lot of lung cancer and exercise research, and finally Professor Kristen Campbell, who is a little bit of a guru in this area, and everyone would probably know who she is. So thank you very much. That's the end of the formal part of this presentation. So I think we'll open it up to questions, I believe, now. So yeah.
So anyone that's interested, you can either ask a question by unmuting yourself, or you can type something into the chat room. And I'm particularly interested in how the people that are here in the audience, what they think about this toolkit, whether they feel it's useful, whether they will refer friends to it. Some of the same questions
is, how far do I push my patients? And, you know, it's really hard to give a really comprehensive answer on a website, but at least, you know, we can offer some, you know, basic thresholds that are already in the evidence, that then hopefully you don't need to go back and look through 100 different articles to try and find it. We've got those, you know, basic thresholds there. And then, you know, there's that using your clinical knowledge, as well as communication with the haematology team as well, about how much you can push the thresholds, because, you know, the Santamina article, you know, has X, Y, and Z written there, but often we are having conversations then with the haematology team about, oh, they're chronically always like this, can we push them a little bit or not? So hopefully this provides you with at least that foundation knowledge that you need. Thank you.
I'd like to make a comment about this. When I was doing my original research back in 2000 on cancer patients, what I always, well, it was a research project, so we did exercise tests with all of them, and we did use the rating of perceived exertion, which hasn't been totally validated in the cancer population, but they were, you know, when they got to, you know, either a 10 to 11 or 12 on the ratings of perceived exertion. And if that was what you wanted, was a lower to moderate level of ratings of perceived exertion, I would purposely tell them, how do you feel right now? And they'd say, well, I don't feel too bad. You know, I feel like I can carry this on. And then that was an opportunity for me to educate them that, see, you don't have to be sweating or out of breath to get the benefits from exercise. Now, you know, agreeably, we do want these people then at some point to have enough training under their skill set and physiologically that we can push them a little harder. But I think it gave them the confidence to know that they didn't have to go out and exercise until they were ill, that even just lower levels of regular exercise were enough to accumulate some of the benefits. So I think, you know, as PTs and as exercise physiologists, if we use that assessment as not only just assessing it for our ability to make sure it's safe for them and find out what some of their, you know, thresholds are, but also to educate them. What are you feeling? And, you know, maybe carry a ratings of perceived exertion with them, or in their head to think about how they're feeling as they proceed. That being said, we do have to educate people about, and Amy can comment on this, if they're in environmental conditions that are really hot or humid, you know, that we have to tone them down a little bit, not to push themselves as hard. So I'll defer to Amy, but that was something that worked for me with the people I worked with.
Yeah, and I agree. So definitely using a combination, and there's an area on the website, I think it's, can't remember if it's in exercise prescription or assessment, but we do introduce the Borg scale and, you know, describe that particularly in cancer, you might need to use a combination of ways to assess their exercise intensity, particularly, you know, women on breast cancer having cardiotoxic chemotherapy. They're probably a prime example of when, you know, they've got quite variable heart rate. And so unless you're checking and recalculating their heart rate thresholds every single session, which in an ideal world we would do, but you know, from a pragmatic point of view in busy hospital clinics, that might not be possible in a group setting. So you might need to use a combination of methods, using the Borg and using heart rate and that subjective experience to prescribe their exercise. So I think there's some questions in the chat, or maybe they're comments. I'm not quite sure. So is there any resources for clinician discussion? So that was from Stephanie. So is this question referring to whether there's like a discussion board or somewhere where people could discuss case studies? If Stephanie's still on the line and you want to unmute, or yes, for case studies or a discussion board. So that was actually something that was discussed, but it never actually came up in the co-design workshops, which was interesting, because I think in my mind, and when I developed this grant application, it was about creating potentially a community, an online community of practice. But it was something that I think ended up becoming a bit broader than the scope of the website and what was agreed on within the discussion board. But I think, you know, that would potentially be a next step, is to have a discussion area, but knowing that something like that would probably need a private members only section to the website that would require further development. So at this point in time, we don't have the resources, unfortunately, because we don't have someone that we can pay, you know, to moderate this website and moderate a discussion board. So I think in terms of the discussions that we had with our co-design group, like we within our Australian Physiotherapy Association, that is often met with other social media platforms. So the APA, we have a Cancer Palcare Lymphedema group where people can have those case discussions. So again, part of it was not reinventing the wheel, as well as potentially not having the resources to be able to do it, but it is a great suggestion. And it's something that I've seen in other areas of physiotherapy and their social media pages, that they do have those kinds of discussions. So yeah, something to consider for the future, definitely.
You know, the discussion board might be something we could consider within IPT-HOPE. So that's a great comment. And we do have members only pages within that. So I'm going to bring that up in our next board meeting.
Yeah, definitely. Because I think it's something that's common. You know, it's not just related to where you live, like it is an international kind of thing. So if that could be something that could be brought together by the IPT-HOPE group, that would be amazing. So we have a question here. With the move to more virtual assessments, do you have any recommendations for aerobic capacity as part of the toolkit? So we don't yet have a section specifically about telehealth and virtual assessments. And that's actually one of my next projects that we'll be launching next year, is actually looking at an RCT of face-to-face compared to telehealth exercise therapy, essentially. I know Kerry Winterstone in Canada has just been, I think she's just done a study, and there's some preliminary results that I think were actually, they did a commentary that was published on Twitter last week about this exact issue, doing virtual assessments for, I think, aerobic and strength capacity. So I'd probably be checking out some of her work, but I know they did a little bit of reliability, validity data with some of the outcome measures that they were using. But the next kind of iteration, or when we progress this website, particularly once we've got results from our RCT, will be to add a telehealth kind of section, knowing that, you know, telehealth exercise rehab is not something that was pretty much done at all prior to COVID-19, and now it is something that everyone does, and it will continue to be with us well into the future. So Christian Barton, who's part of our research team, he's actually developing a telehealth website on this platform, that has a focus on osteoarthritis and musculoskeletal conditions, but has some broader tips and tricks that will probably end up linking to this page, you know, within the next 12 months, and then we'll refine that for cancer rehabilitation as well. So that's a watch this space on this space.
And I have a question here.
Yep.
Yeah, this is Jnanashekar here from India.
Great, thanks for joining us.
Actually, yeah, sure. And if there is any possibilities, if you can able to add a page for a patient-centric care, like self-motivating exercises for the patients alone, so that we can refer them, go search in there where they can get a set of exercises for like standard exercises that we give for breast cancer patients or head and neck cancer patients likewise.
Yeah,
So if possible in future, you can able to act on it.
Yeah, so I would suggest, so we do actually have some of those self-motivating exercises that patients can do on their own already embedded. We didn't design them, but they're links from other websites. So if you go to education and then patient education, so the Cancer Council New South Wales, so if we click on this, so this was designed by exercise physiologists, and physios had input into these exercises. So they've got it broken up in terms of core exercises people can do safely, upper body, and then lower body. And these are videos that patients can then go along and follow themselves. We also have, if you go to the one group, my internet's just a little bit slow. So these ones were designed by Penn State, and they've got, again, broken down in all different sections, and their videos provide different modifications of exercises as well. So if is that kind of the thing that you're suggesting?
I'm suggesting directly as condition based for a breast cancer patient alone. Yeah, likewise. So that the patients will be highlighted, because a dumbbell press or a shoulder press we can't allow a breast cancer patient to do on the affected side. So like patient centric, we can have a page.
Yeah. So I think the issue with that, and it was something that was kind of brought up when in the co-design process, is the scope, knowing that there's lots of resources that are already out there. So this is really based for more general exercise rehab, and knowing that patients will be supervised by a physical therapist or an exercise physiologist who can then guide them through. So this really does provide more of the bones of basic exercise that then physios can go and, you know, further modify and individualize that as appropriate. But yeah, definitely a good suggestion. Anne.
Thank you.
Yes, great questions, great presentation. Thank you. What are your plans for upgrading the website and adding to or making changes to the website?
Yeah, so at this point in time, like, it's on my agenda now that the website's been around for nearly 12 months, that we need to make sure that our locations are updated and that our evidence is up to date. As I mentioned before, I'm really keen to add a section about telehealth on there. I think that's probably one of the priority areas. The challenge that we have is that now that the project is over, we no longer have funding to, you know, just focus on this website alone. So it's left up to me and my colleagues to kind of do it as we're able to do it. So we can't necessarily do anything too fancy or outrageous, you know, at this point in time. But yeah, I think my main focus is making sure that the content remains up to date, as well as adding to it in terms of telehealth as well. I would love to add a discussion board section to it as well, which has been suggested. I just don't know if we've really got the scope or resources to be able to further develop it in that particular way. So if anyone else has any other suggestions, feel free to contact me. In our feedback from our survey, there wasn't anything too outstanding to really add that didn't come up as like a recurring theme. A lot of the comments were around navigation and that kind of thing. But something that we do definitely want to do is make sure we can get some kind of endorsement and promotion from our peak bodies. So that's probably the next and most important step at this point in time. So we're reaching as many people as we can.
Any other questions?
Actually, Jacqueline, this is for you actually. And if possible, you can able to formulate and protocols, right? Like what we do for an indigenized cancer care, like for breast cancer, what will be the protocol of rehabilitation, and head and neck cancers, what will be the protocols. So that I've been searching for an registered or an authorized protocols, but I haven't got any protocols specifically. So that if I am going to make a study on anything, if we have an underlying based protocol that is following all over the world or in a particular part of the world, where we can quote that and we can formulate it and we can use it in the Indian platform. We have a setback here because we doesn't have a structured protocols. So if you people have any protocols over it, you can display in the website so that we can able to get the concerns from you and we can able to formulate it with our research here.
And that's a really good point. And again, something that was discussed in the development of this as well is that there are I think one of the issues are that there are not any standardized protocols necessary, like protocols, particularly for surgery and things, will differ from specialist to specialist, and then they're constantly being updated as well. So I think that alone would be a massive project. You know, if we could have some standard protocols, that would be fantastic. But I think that's kind of a big standalone project on its own.
Yeah. You know, in response to that, right now, the World Health Organization has invited, this was last spring, they invited people to apply to be on a committee where we develop guidelines for exercise, not just exercise, but cancer care for particularly countries with low resources. And several of our members applied for the position. And I know Abu Sinadhi, who's our pediatric specialist, was one of the people that's on the committee. And Anne, can you remember who the other person was? Oh, was it Nena Chagbo?
Yes.
Yes. And then, so it was supposed to be a project that was finished by now, and then it was supposed to go to the reviewers, and I'm one of the reviewers for the whole protocol. So I would look for that. That's coming out, but it's obviously not coming out in the timely fashion that they wanted. And I'm personally not surprised because, you know, look at all the time and the work that it took Amy to get her website up, you know, just as a resource, and now to go and talk about the protocols. And it's hard to generalize it to every single patient because there's so many comorbidities that they can come in with a cancer diagnosis. So I think there are touch points that we have to have in protocols, again, to give people confidence in what they're doing, but it takes the skill of a physical therapist, whether it's a generalist or an expert, to really tailor make those programs and address the psychological, you know, making them feel safe within their space. Not that I'm trying to say that we're the psychologists, but to recognize if they need a referral to other healthcare professionals too. So that's been thought of, you know, and it's being sponsored by the World Health Organization, but it's still underway. So when that comes out, I think that'll be a really nice guideline, you know, in addition to what we have. But again, it's very multi-faceted and complex. I based on what you're asking too, I want to give a segue that we're going to have another presentation come up in just a few short weeks on December 4th. And we had requests from some of our member organizations to have a presentation that talks about how we develop skills in physical therapists from the entry level to, generalist practitioners to advanced practitioners to expert practitioners. And Marianne Dalzell, who's the president of the oncology section within Canada, is going to be one of our major speakers, because they do have a whole program put together in Canada for developing skills. And then Janine Hitting from the Netherlands is also going to come and talk about lymphedema. And it's going to be interesting because we have students from Scotland, from Chiwi Tan's group, student group, and they're going to actually host the session. So we're trying to get students to get involved in some of these oncology matters. I just wanted to ask Amy a question too along those lines. Did you notice, or was there any information that students or new graduates were accessing these pages? And then, one of the things that we want new students to do at the very baseline is recognize some of the morbidities that can occur with cancer. And then if they can't treat them, to know how to refer them on. So did that come out at all in your studies?
Yeah, so students were actually excluded from the survey. So we don't have information about students per se, but they did have access to the website, but there's no way of us knowing who was who. We did have a breakdown of experience, but we weren't really able to see changes because of the really poor response rate. There's just no point in trying to analyze that data by years of experience, unfortunately, but it would be interesting. Certainly, we did a national survey of physiotherapists, I think in the year prior, and it's really those undergraduate, anyone with less than 2 years of postgraduate experience, they're the ones that are really the least confident and feel like they need the most support, which, is understandable. So they're a group that we potentially do need to target.
Thank you. Thank you. Any other comments or thoughts? If you want, you can type questions into the chat room.
Might want to go back to their weekend.
I know. Eric Galvez, who's runs our IPT-HOPE website under Anne. Anne is really responsible for the website and putting it all together. But Eric has put on the American College of Sports Medicine guidelines from 2019 on the chat. So if people want to copy that, that's an excellent resource. There were actually 3 papers that came out around that time by that group. And one I think was in clinical oncology, and it was how to assist physicians with referring to oncology rehabilitation. So that was a really important area, because that for a lot of countries is still a touchstone problem that they're trying to be recognized as important and vital to the oncology team. So those are some resources people could look for. Any final questions? Now's your big chance internationally to get your questions or your comments out and known. Okay. Anne? Oh, you're applauding. So Amy, I want to sincerely thank you for this information. This was, it was clear, it was logical. I think it's readily applicable, in its current state. And I think it's exciting that, that you're going to continue on with this, because we know things in cancer can change, over the course of a year with different treatments and different side effects from the treatments, or new things that we find out, or even new issues that our patients have. So Nena Chagbo is our education lead, and unfortunately she couldn't be here tonight, but she will be sending you a certificate, and it's to recognize you as an international scholar from IPT-HOPE. So I'm so pleased that you were here and able to educate our group and talk to our group. And I hope we can continue some of this, especially, I know we're looking for presentations for the Congress in Japan in 2023, the World Physiotherapy. So possibly we can get together and address some of these questions for that special Congress.
Well, thank you again for having me. It's always, a pleasure to talk about exercise and cancer. It's definitely my area of passion, and it's great to connect with international colleagues and hear what else is going on and being able to support people not only, within my own local context. So thanks again for the invitation, and to all of you on the line, just wish you all the best with your future, physiotherapy prescriptions for people with cancer. And yeah, you all are doing an amazing job. So.
Thank you, Amy. This is an amazing resource. We're so proud that you were here and shared it with us. And I think you're going to get a lot more hits on that website now.
Yeah, hopefully.
All right. Thank you, everyone, for your attendance and your questions. And have a great evening.